Bismillahirrahmanirrahim. Assalamu alaikum. My name is Alia Naseer, lecturer at the Department of Health Professional Technologies, Faculty of Allied Health Sciences, the University of Lahore. Today we are here to discuss about the surgical site infection. First of all, we should know about what is surgical site infection. Surgical site infection is an infection at the surgery site that occurs within 30 days after the surgical procedures. It leads to increased morbidity, mortality, and increased hospital stay, and obviously increased cost. Next is the types of surgical site infection. Here is the three types of surgical site infection. First is the superficial incisional surgical site infection. Second is the deep incisional surgical site infection, and third is the organ space surgical site infection. Superficial incisional surgical site infection is an infection that occurs within 30 days after the surgical procedures if no implant is left in place, or within 1 year if an implant is in place. It involves the skin and subcutaneous tissues. Second type is the deep incisional surgical site infection, which occurs within 30 days after the surgical procedures if no implant is left in place, or within 1 year if implant is in place. It involves the superficial tissues, muscle and muscular layers, and deep tissues. Third is the organ space surgical site infection, which occurs within 30 days after the surgical procedure if no implant is left in place, or within 1 year if implant is in place. It involves any part of the body, excluding the skin and subcutaneous tissues, fascia and muscular layers. The patient must have one of the following: purulent drainage from the drainage placed in organ space, and organism isolation from a culture. Next, we further classified the surgical site infection on the basis of their severity. First is the minor surgical site infection, and second is the major surgical site infection. In minor surgical site infection, discharge without cellulitis or deep tissue destruction occurs. But in major surgical site infection, first discharge with the tissue breakdown and partial or total dehiscence of the deep facial layers of wound. Next, we classify the surgical site infection into early, intermediate, and later surgical site infection. Early surgical site infection occurs within 30 days after the surgical procedure. Intermediate surgical site infection occurs between 1 to 3 months after the surgical procedures. And later surgical site infection occurs more than 3 months after the surgery. Next, we were discussed about the risk factors for developing surgical site infection. There are 3 risk factors. First is the patient-related factor, second is the local factor, and third is the microbial factor. Patient-related factors involves the older age, malnutrition, diabetes mellitus, peripheral vascular disease, smoking, anemia, and radiations. Local factors involves poor skin preparation, contamination of instrument, and inadequate antibiotic prophylaxis and prolonged procedures, hypoxia and hypothermia. We can classify the wound into 4 categories. First is the clean wound, second is the clean contaminated wound, third is the contaminated wound, and fourth is the dirty wound. The infection rate is clean wound is 1 to 2%. Infection rate in clean contaminated wound is less than 10%, and in contaminated wound is 15 to 20%, and in dirty wound infection rate is very high, which is greater than 40%. Pathogens involved in surgical site infections involve the Enterococcus, Candida albicans, E. coli, Pseudomonas, Klebsiella pneumonia, Alpha hemolytic Streptococcus, Corynebacterium, and Staphylococcus aureus, and etc. Next is the management of surgical site infection. We can treat surgical site infection. First is the mostly we remove sutures with drainage of pus, and other preventions for the surgical site infection is three factors involved in the prevention of surgical site infection. First is the pre-op factors, second is the intra-op factors, and third is the post-op factors. In pre-op factors, skin preparations involves, and antiseptic showering involved, patient skin preparation है, pre-operative hand forearm antisepsis involved, in which alcohol solution chlorhexidine and iodophorus gluconate used in operation theaters. Antibiotic prophylaxis is also used in pre-operative preventions. But for clean wound, we do not use antibiotic prophylaxis if no prosthetic involved and non-complicated surgeries. But if clean surgery with placement of prosthesis implant involves, then we used antibiotic prophylaxis. And for clean contaminated surgeries and contaminated surgeries, we used antibiotic prophylaxis. One thing should be remembered here. Once the incision is made, then antibiotic prophylaxis is impaired. Hence, antibiotic prophylaxis should be used before surgery, before incision. Intra-op factors involves the PPEs, personal protective equipments, asepsis and surgical techniques involves, and operating room environments is also involved in intra-op factors. Temperature should be between 68 to 73 Fahrenheit and humidity should be 30 to 60% during intraoperative procedures. Post-op factors involves incisional care. In incisional cares, we use the sterile dressings for 24 to 48 hours, and dressing should be changed daily. When we change the dressing, aseptic techniques should be used for dressing removal and dressing change. In post-operative cleansing, we use sterile salines for wound cleansing up to 48 hours after the surgery and advise the patient that they may shower safely 48 hours after the surgery. We use tap waters for wound cleansing after 48 hours if the surgical wound has separated. To sum it up, we can say that surgical site infection is an infected wound and SIRS is systemic inflammatory response syndromes in which exaggerated immune response start. MODS is multiple organ dysfunction syndrome in which the infection produces systemically. MSOF is multi-system organ failure, which is the end stage, and ultimately MSOF, which is multi-system organ failure, leads to death. Hope this video is informative for you. Thank you. Allah Hafiz.